Welcome to the studio and to the desk of our good friend, Dr. Nathan Boonstra. He is here from UnityPoint Health as we are talking about what's on everybody's mind right about now is it's cold and flu season. The flu, definitely. People are talking about that. So we need to ask you some stuff about flu season. Okay, last year, a lot of people got flu shots. Some people didn't work so well.
And last year was kind of a bad match of a season. So
what does that mean?
It means that one of the flu strains, the most predominant one, it actually changed its structure enough that the flu shot didn't cover it as well as we wanted it to. And the estimates for how effective the flu shot was last year was about 23%, which is not as good as we want. It's still a good 20% reduction in influenza if you were vaccinated. Now, if you look at over time, if you look from year to year, studies will show that the flu vaccine is maybe 60% effective or so. So that's a good reduction in influenza if you're getting your flu vaccine every year. Some years are going to be better. Some years are going to be not as good. This year it should be a lot better.
Isn't it always a guessing game? Like they have to kind of guess what strands are going to be.
I hate to call it a guessing game. I mean, they look at what strains are coming, what is likely to be circulating. Sometimes there can be a change from what they're expecting. But as far as we can tell right now, looking at influenza that's occurred in the country, including in Iowa, the strains seem to be a good match. So it's definitely a good idea to get your flu shot. And now's the time to do it.
Let's throw it in reverse and talk about, I always like to bring this up, what the flu is. Because people think flu is stomach, intestinal, and that's not what the flu is.
In fact, that word stomach flu, that phrase, it kind of gets our goat a bit as doctors, because the stomach flu has nothing to do with influenza. So if you have vomiting or diarrhea, that's a virus most likely. But it's not influenza. Influenza is a respiratory illness. So that influenza will give you high fevers for a week. It'll give you bad coughing, and it puts you at risk of pneumonia. But it has very little to do with the GI tract. With
so if we're feeling achy and pukey, that's nothing to do with
that's just being in broadcast.
or partying too late at night.
Because, you know, if we're going to our doctors and we say, I think I have the stomach flu,
I think you can say stomach bug, but we call it gastroenteritis.
Yeah, I won't remember that. Okay, stomach
bug. Try to avoid the word flu unless you're really talking about influenza, which is a respiratory disease.
And you feel like you got hit by a truck. And,
Okay. All right.
So it's okay. Don't feel bad about yourself.
Well, I've used that for years because that's what I thought it was. So it's always interesting to learn something new. All right. Let's talk about one of the main reasons why people need to get the flu shot. Because everyone's like, well, it makes me feel bad, or it gives me the flu. Why would I be sick? Why would I be getting the flu shot?
The reality is the flu shot can make you achy a little bit. It can give you a fever. That's your immune system kicking in. You kind of want that.
And how long does that last for some people?
That should last just a day or so. And most people don't even get a fever. I mean, I get the flu shot every year. It gives me a little bit of a sore arm for a day. That's all that I get. Some people might have a little bit more robust response where they get a bit of a fever. But if you're getting anything like those respiratory symptoms, or if you're getting vomiting or diarrhea, that means you picked up a virus at some point. That's
you were
not
going to get sick anyway.
Yeah, you probably got the stomach flu.
We give
Lou, what have we learned here today?
Just kidding.
We give the flu shot. We give it during the season in which there's a lot of viruses out there. So the chances that somebody is going to get one of these viruses within a stone's throw of their flu shot, fairly likely. And that can even happen multiple years, and so people get convinced that they get sick from the flu shot. But unless, you know, like I said, little fever, little achiness, yes, that can be from your shot. Respiratory symptoms, anything that's like a cold or an influenza-like disease, that's not from your flu shot.
Now, doctor, when people say, I just don't like shots, I'm not going to get the flu shot, you have another alternative.
We do. We have a mist, so that's a nasal spray, and we try to give that. I try to give that to kids whenever I can because makes them less afraid of me in my clinic. And there's also some studies that show, at least in kids, it might be a better choice in terms of its efficacy. In adults, not as clear, but some studies indicate that it's better in kids. I really say whatever is available when you can get it. You want to get that influenza protection on board. And now's the time to do it.
Doing a lot of work with children's charities, I always promote getting the flu shot, not only for us, but for so many people out there that can't get the flu shot because they have a deficiency in their immune system.
Right. So there are kids, I take care of kids who either can't get the flu shot, or it's not going to work as well as it should because their immune system doesn't work as well as it should, or they're just more medically vulnerable for other reasons. And so those kids need protection, and we can all help them by getting our flu shots so that influenza doesn't spread as well. And that's why it's actually even more important in kids, especially grade school kids and kids in daycare, because those are the areas where influenza spreads the most. These kids get and spread the most influenza, and they're the most likely to spread it to vulnerable populations, both kids who have these immune system issues, and also the elderly, who are most at risk of complications like pneumonia and, in fact, death from influenza, and in whom the flu shots don't work as well. Flu shots work very well, and probably the best in kids, in grade school kids and whatnot. And by immunizing kids, we can prevent deaths and bad outcomes in other populations, including our grandparents.
So don't always think about yourself, think about the kids you could be helping around you as well.
Why are you Dutch people all so tall?
That's just genetics. Okay. Yeah.
Okay,
That's a whole nother conversation.
Final bit of advice. Again, you obviously don't want to get the flu. The simplest things you can do to help avoid getting, besides getting a flu shot, simple things.
Wash hands, okay?
And that's
Good
really
hand hygiene,
basic,
very
though.
important.
But that is important.
It's extremely important. Covering your mouth properly when you cough, okay? Not coughing in your hands, but maybe coughing in your elbow, or just getting away from people when you're going to cough or sneeze. And then staying home when you're sick, okay? Especially if you have a fever. If you have a fever that's getting up, we define fever as 100.
Stay home when you're sick.
Quit looking at me like that.
But it's a good idea it's a bad idea to send a child with a fever to school.
Doc, if we want more information, how can we find you, or just more information on the flu?
Oh, well, you can find me on Facebook and Twitter.
Yeah, tell everybody your Twitter handle. I love your Twitter handle.
Well, I'll tell you the website too, PedsGeekMD. .com, or you can find my Twitter handle is the same thing, PedsGeekMD, because I like to talk about the new Star Wars movie just as much as I like to talk about vaccines.
Yes, we're
so if you like those two topics, I'm the guy you want to follow.
And of course, UnityPoint as well, a great website to go check out.
And Blank Children's
as well. Thank you so much.
Thank you, Doc. Thank you for being here. Thank you so much.